with many people still without power, without AC, and you combine that with the hot temperatures Justin was just talking about, a lot of us are trying to find ways to stay cool. Here live in studio this morning to share what to do to prevent heat-related illness is Dr. Carrie Bakunas with UTHealth Houston. Good morning.
Good morning.
Bakunas. So what kinds of heat-related illnesses should we be on the lookout for today too? I mean, there's heat exhaustion, heat stroke. Is that mainly what we're talking about?
Yeah, so heat-related illness is really a range of conditions that can be something as mild as a rash to something as severe as a heat stroke. So it really just depends on the symptoms and the severity of the exposure.
Even a skin rash, you mean? You
like
can get from
rash.
just being in too hot of temperatures?
Exactly.
Okay, what would that look like?
Just like little red bumps, redness on the skin.
So if you see that, you know, like, okay, like I've been hot for too many days now, you know, since Monday we haven't had any power. And then what should you do if you start feeling like the headache and the fatigue? What can we do about that?
So the most important thing to do is to be able to know what the signs and symptoms of heat-related illness are. So like you said, headache is one of them, nausea, vomiting, muscle cramps, lightheadedness, passing out, and then more extreme things like confusion, and then also elevated body temperatures. Those are things to definitely look out for.
Yeah, and so what should you do? Like if you notice the more subtle symptoms, what should you do? I mean, normally the recommendation is to go inside and cool off. In a lot of people's situation, we don't have an inside to go to.
Yeah, it's really hard right now with all the people that are without power. But during the highest or the hottest times of the day, the best thing to do is probably get outside of your hot house, get to a cooler environment. You can go to a mall, you can go to a movie theater, you can go to a library. There are cooling centers throughout Houston, so that's really helpful in preventing it. Also, drinking lots of water, avoiding drinks that are high in sugar or alcohol, and then wearing lightweight, light-colored, loose-fitting clothing. Those are all things that can help prevent heat-related illness.
And so if it gets more severe than that, you know, I mean, a lot of times that confusion, passing out, we tell people that means go to the hospital. Like that means you're in bad shape. But also we see it in our G, you know, like we've got a medical overflow right now. So is that still the best recommendation?
Yeah, so, you know, again, recognizing symptoms when they're mild and getting out of those hot conditions is really best. But if symptoms progress and you've got nausea and vomiting that's not well controlled, if you pass out, if you've got confusion, those are all reasons to come to the hospital to be evaluated.
And that's mainly for adults. Is the signs and symptoms of heat-related illness in children any different?
Yeah, so the symptoms are pretty much the same. The difficulty is kids' ability to articulate what symptoms they're having. So you've got to be especially vigilant as a parent because they are a more vulnerable population. Looking out for signs of heat-related illness in your children, you know, keeping them cool, keeping them hydrated, which can often be a challenge with young kids.
Yeah, it can be. And they can't tell you when they're feeling well, and they say that they don't feel well, like, oh, like my head hurts or something, and you're like, is it a bug? You know, there's other things going around too. It can just be kind of complicated.
Yeah.
Who is most vulnerable when it comes to heat? I know you just mentioned children, but also older adults too, right?
So children, elderly, and then of course people who have to work outside. They're especially a vulnerable population because it's hard for them to avoid the excessive heat.
Yeah, and so when we're talking about people who are maybe starting their job right now, going into the hotter part of the day, is there anything that we can do to prevent heat-related illness?
Yeah, again, trying to stay in the shade, hydration, and if someone starts to experience heat-related illness symptoms, you can, you know, splash them with cold water. You can apply ice packs to the armpits and the neck area to help cool that body temperature down.
Do you work in the emergency room?
I do, yes.
Okay. So have you seen any heat-related illnesses because of the storm?
We've seen a lot of things from the storm, not quite yet a ton of heat-related illness. It's something, though, that we see every summer in Houston, and we tend to see the most extreme cases. So that's why it's important to prevent yourself from developing heat-related illness and then recognize the signs and symptoms early.
What else have you seen come in as a result of Beryl?
So a lot of patients without power that can't get their oxygen or their dialysis, some burns, so things along that line.
Terrible. Okay. Well, we wish you luck in continuing to treat and take care of those patients. I'm assuming that you haven't seen the last of them yet.
No.
So I know that you have a busy week, and we appreciate you coming into the studio to talk about these things.
Thank you for having me.
Yeah, very important. Dr. Carrie Bakunas, we appreciate your time this morning.